Someone once said, if it isn't broke, don't fix it. Washington State's credentialing crisis. The state of Washington has a health care credentialing crisis. This crisis will continue if healthcare professionals do not comply with national board healthcare best practices. Every healthcare provider should be registered as a national provider of healthcare. This registry will allow you to bill for the services you provide nationally. It also allows you to track each area of specialty. The National Provider of Healthcare Registry authenticates each and every healthcare professional. This information is then given and compared to other state health boards. The healthcare board will allow you to look up a provider in that state. State boards do not authenticate healthcare providers, but rather license and give permits to healthcare providers. When a state does not authenticate its healthcare providers, that means that the healthcare providers do not compare to other healthcare providers in other states. They are below the national standards. The state is then asked to create a rule or a plan in place that could bring all of the healthcare professionals in that state back up to national standards. When this is done, it is called a health care authority. When a state is asked to make or create a health care authority, this is because the state's credentialing for their healthcare workers are below the national standard. It takes 10 credits, 10 higher learning college credits in any area of the social sciences: biology, psychology, pharmacology, and sociology. These are the areas that all doctors derive from in the social sciences. Doctors that we would consider to be healthcare doctors. All doctors must earn at least one or more major areas in the social sciences. You are only permitted to work or teach within the major areas or areas you have earned your credentials in. This is your scope. The National Board of Health sets standards and best practices And these standards are expected to be followed at the state level, where the state provides licenses and permits. You cannot work outside your scope or teach outside your scope. Allied health care is considered to be communed. This means that once you receive your major in the areas that I mentioned, biology, psychology, pharmacology, or sociology, then the other programs will allow you to receive the rest or remainder of the credits you need. These are called allied health care. These credits are the same across the board. The National Board of Health sets curriculums for each healthcare profession. And these curriculums are then put into best practices for that specific association. At the state level, providers are able to get licensed in their state to provide the specialty that they so choose to provide. The National Board of Health sets the standards for best practices for each profession. The State Board of Health provides you with a license. You must be first authenticated, meaning have the correct credentials that meet the best practices in the association or profession or the major area of study. These associations, again, are regulated by the National Board of Health. They create curriculums to address best practices for their association. These curriculums are to be taught nationally and uniformed across the board. There should not be multiple curriculums for a national association. The National Board of Health has, again, several national boards because each profession maintains their own national board and standards of best practices. So the National Board of Health regulates the professionals, and the state provides license for the professionals. If the National Board of Health creates the best practices, then you must adhere to the best practices of the National Board of Health in that profession. Allied health programs are supposed to be uniformed across the board. So when you study a major area of science like biology, then you would be able to go into an allied health program. It is not expected that you continue to learn the same things if you've already learned these things in allied health. Because outside of the major area that you're studying, allied health credits and credentials are the same for all professionals across the board. The goal is to profess to the highest degree in your major area that you're studying: biology, psychology, pharmacology, or sociology. Once you are able to do so, you will take an examination at the USMLE for doctors who profess to the highest degree. Then you are also able to get placed in the National Provider Identification Database, where you can be identified as a national provider and your specialties and expertise can be listed to the public. This database, again, authenticates each and every healthcare worker's credentials. It compares each degree, each certification to all that is in the database to authenticate the level or classification of your professional title based on your credentials, not based on your position at work or based on a training someone has given you. Remember, trainings and certifications that are taught by someone who does not have a major in the area does not count in the national database. The National Provider Database ensures that each and every medical professional is authenticated and has the correct credentials for the correct title and the correct scope of work. You are given a provider number, and this number is attached to any billing for any services that you may provide. It also allows you to accept national insurance carriers for your clients, consumers, patients. The national database is also a way for client, consumers, coworkers, colleagues, and the others that may want to verify your credentials. Why is this important? Because we want to adhere to best practices, and these best practices are set again at the National Boards of Health. These are the professionals that set the standards. So, if you are in your state and you have a credentialing title at the State Board of Health, and you went to the national database and put your information in, your information could authenticate to where the state has you, or it could go beneath or above that. Because again, we are comparing your credentials across the national board. So the level of scrutinies, of peer review scrutinies, would be at the top tier for national standards. Professionals with degrees, certifications, and any other specialized training in the healthcare field should go and register with the National Provider Healthcare Database, where your credentials can be authenticated and you can network with insurance providers to provide the best care and services for your clients, consumers, and patients. What does this mean? This means that if you have a practice in one state, you are able to have practices in various states. So, again, an opportunity to grow your company's brand and your practice's name so that you are able to bring more services and people are able to have better access to the services you provide. The MPI number also allows a medical professional to contract services with state agencies and other organizations by going into care management systems and billing for services needed or services provided. What is the answer to Washington State's healthcare credentialing crisis. When the National Board of Health and the NPI system does not authenticate professionals who are licensed through a state board of health, on a national level, these individuals do not meet the standards nationally. So when you have a state board of health that has uploaded all of the healthcare providers in their state up into this database, and the database does not authenticate the health workers, and it is shown that the state is out of compliance and does not meet the national guidelines for national providers. Although they are providers in the state of Washington, they are not recognized and authenticated nationally. What does this mean? This means that Washington is asked to practice outside of the national standards, and they are asked to come up with a plan. And this is where you get your healthcare authority again, that suggests that you all are under compliance, you're beneath regulations nationally, and so we recommend that you come up with a plan to regulate yourselves so that at some point you may be able to come out of this crisis and adhere and meet the standards of national credentialing. So they created a board, healthcare authority, of 5 members, and these members are the authority of health in the state of Washington. And they are in charge of coming up with the plan for all of the healthcare workers who are licensed in the state of Washington but are not recognized in the national healthcare system because of the credentials. In the Washington State Department of Health system allows a provider, a medical provider, a healthcare provider, to work and continue to work and provide healthcare. However, nationally, they are not considered to be authentic. So what they did was different states came up with different ways on how to try to regulate themselves, and it at best met the compliance at 3% more, which was still well below what was required. My hopes for this documentary, this 20-minute documentary, is to point out that we do have a credentialing crisis, and the object of the game, people and folks, is to go all the way up to the top to PhD level so that you can keep your colleagues, your community credentialized, so that we are able to meet national levels and be able to qualify for insurance carriers for our patients, and have our community at large know that they are dealing with a professional who has the education that meets the National Board of Health standards. So we must teach and we must give back. We must go all the way up and we must stay up so that others can come up. This is how we address Washington State's national credential crisis. We can no longer hold the people at the top down. We, as citizens of Washington State, can do better. A Finney Coup.